Hello, everybody. We are pleased to present to you today our food supplement BellaVie Synbioceutical WOMAN, a breakthrough in the management of bacterial vaginosis demonstrated through a clinical trial conducted by BellaVie at the Department of Obstetrics and Gynecology of Professor Tansu Kucuk in Istanbul, Turkey, whom we have the honor to welcome today. In this presentation, we will present the dysbiosis of the vaginal microbiota that can lead to bacterial vaginosis. We will talk about the therapeutic options and mainly the antibiotic treatment, our solution Synbioceutical WOMAN, the clinical study, the scientific evidence of our formulation and marketing support that we provide. The vaginal microbiota and its dysbiosis that can lead to bacterial vaginosis. A healthy vaginal microbiota is mainly composed of lactic acid bacteria, including lactobacillus. This flora is called the Döderlein flora. Its role and functions are mainly protective against external infections by maintaining an acidic pH and by stimulating the immune system. Bacterial vaginosis is considered as a dysbiosis, therefore an imbalance of the vaginal microbiota. This dysbiosis can be caused by different factors: vaginal douching, hormones, tobacco, antibiotics, extreme hygiene, stress. The bacterial vaginosis is one of the most common causes of vaginal discharge in women of reproductive age. BV represents 1/3 of all vulvovaginal infections. Bacterial vaginosis is generally treated with antibiotics. It is characterized by a decrease in lactobacilli and an increase in pathogens and an increase in pH. A vaginal bacteriosis can lead to other disorders such as upper genital tract infections, complications of pregnancy, or urinary tract infections. On this slide, we can see the effects of a dysbiosis of the vaginal flora compared to a balanced and healthy flora. The balanced flora plays its protective role by producing lactic acid and antimicrobial components. In case of dysbiosis, the microflora will allow the implantation of pathogenic strains. These pathogenic strains will attack the vaginal mucosa and will thus lead to an increase in the production of pro-inflammatory cytokines and interleukins. In terms of treatment options, the main option at present is the use of antibiotics. However, the recurrence rate after antibiotic treatment is high, reaching rates of 30 to 50% within 3 to 12 months of treatment. Multiple antibiotic treatments can lead also to superinfections, for example, with Candida, or to antibiotic resistance. Thus, a complementary approach via the use of probiotics could be a solution. In addition, Europe has decided to reduce the use of antibiotics by 20% by 2030. We would like to present our solution, BellaVie Synbioceutical WOMAN, a solution to a problem that affects 1/3 of women and poses a problem of recurrence and risk of resistance and superinfection. Our oral food supplement is composed of a richly diversified blend of 7 probiotics, including lactobacillus, bifidobacterium, and bacillus. Also, prebiotic to boost the growth of probiotics, as well as 36 milligrams of cranberry proanthocyanidins, which have an action on urinary tract infections. Our BellaVie Synbioceutical WOMAN was the subject of a preclinical study carried out in Turkey by Professor Tansu Kucuk. I would now like to give the floor to Professor Tansu Kucuk to present his first results. Dear Professor, the floor is yours.
Thank you, Olivier. Hello, everyone. In the first part, you have heard about the concept of microbiota, vaginal flora, vaginal dysbiosis, and of course, the bacterial vaginosis, which is the topic. The standard treatment of bacterial vaginosis for the time being is antibiotics, previously. The advantage of antibiotics is that they are used for a short time. But antibiotics are not smart drugs, of course. They affect not only the pathogenic and excess microorganisms, but also the microbiota itself. Therefore, They cause frequent recurrences and subsequent candida dysbiosis despite short-term relief. Having these in mind, we hypothesized that restoring the normal vaginal flora might be effective in bacterial vaginosis treatment. We designed a study to compare the vaginal microbiota with the use of antibiotics and with probiotics in equal conditions. This study was conducted at a randomized, controlled, open-label trial at Acıbadem Maslak Hospital between August 2022 and December 22. At the initial visit, we got the anamnesis of the patient. We did a speculum examination, checked the pH of the vagina with test strips. 91 patients were initially recruited. We obtained vaginal swabs for culture and simultaneous HPV co-testing. We included the patients between the ages 20 and 40, non-smoker, non-vegan, non-IUD user, non-pill user, no systemic diseases, and no active sexual life in the past month. After having received the vaginal culture results, cases with mixed vaginal dysbiosis were excluded. Additionally, patients who had menstrual or abnormal bleeding during the treatment, who engaged sexual activity during the treatment, and the ones who deviated from the treatment protocol were also excluded. In order to reach a pure bacterial vaginosis group, we were very strict about the inclusion criteria. That is why we went down to a sample size of 28 from the initial 91. Because the study was performed by 3 different physicians, we used a computer-generated pre-randomization according to the admission of the patients. 15 patients were allocated to probiotic group, while 13 were in the metronidazole group. 1 patient in probiotic group and 4 patients in metronidazole group came back with severe complaints of vulvovaginal candidiasis before the completion of the protocol. So they were given antimycotic treatment and they were excluded in the final analysis. Microbiota samples were collected on the day of clinical diagnosis and on the first day after completion of the treatment. Samples were kept frozen at -20 degrees Celsius until the time of analysis, which was 6 months later. Analyses were done using next generation 16S rRNA sequencing. The 2 groups were comparable in baseline characters like age, fertility, BMI, and other confounding factors. Next slide, please. Probiotics are conventionally given either intermittently or continuously for long periods, like a month or so. We gave probiotic orally at a very unusual short schema to its disadvantage in order to minimize the variables of the study. The preparation consisted of probiotic, which is namely BellaVie, were given 7 days, twice daily, same as metronidazole 500 milligrams. Next slide, please. Here is the table comparing the results in both groups before and after the treatment in terms of total vaginal biomass, Lactobacillus species, and 2 Lactobacillus strains. Mann-Whitney U-test and Wilkinson signed rank test were used where appropriate. But this is a crowded table, so let me show you some graphics to help your eyes and ease your mind. On the left upper corner, you see the results of total biomass. There was no statistically significant difference in baseline biomass values between the two groups. Total vaginal biomass was comparable in probiotic group, but increased in the metronidazole group. This can come to you interesting, but this finding was due to the iatrogenic increase in Candida albicans dysbiosis as indicated by clinical examination and proven by the response to antimycotic treatment in patients. Lactobacillus species on the upper right corner was increased significantly after the probiotic treatment, but in the metronidazole group, it was significantly decreased. And on the left and down, you will see the Lactobacillus rhamnosus results. You can easily see that copy number was detected in the metronidazole group was decreased, while in the probiotic group stayed stable during the treatment. That clearly indicates that BellaVie replaces the lactobacillus perfectly during the treatment. On the right and down, you will see the Lactobacillus acidophilus results, and population was similar to that of pretreatment levels in probiotic group, while in the antibiotic group, it is significantly decreased, which shows that antibiotics can affect pathogenics plus normal microbiota as well. So next slide, please. In conclusion, patient complaints and side effects was much better in the probiotic group, indicated by microbiota results. Oral probiotics is not inferior to metronidazole for bacterial vaginosis treatment. Even under adverse conditions of the use, they do not comply with the original treatment schema. As this was a preliminary study, it is not possible to draw strong clinical evidence. Definitely larger studies are needed to reach statistically significant results, but these are very promising results for start with. And if we get better results, then we can promote the BellaVie from being a food supplement to the class of medicine. And one last thing, since the completion of the treatment, which is almost 18 months now, none of the patients in BellaVie group came back with recurrences, but the antibiotic groups, we received 3 patients back for recurrence by bacterial vaginosis. And thank you for your attention. If you have questions, ready to answer.
Thank you very much, Professor Kucuk, for this brilliant presentation. I would like to complete this presentation with other scientific evidences on the formulation of our product. So, Chen, in 2022, demonstrated in a meta-analysis of randomized clinical studies, including 20 randomized clinical studies on more than 2,000 patients, that probiotics are a good choice for treating bacterial vaginosis and could effectively and stably restore the vaginal microflora and maintain a normal vaginal flora for a longer time. Also, Wang in 2019 had already demonstrated in a meta-analysis, including the results of 10 blinded randomized clinical studies, including more than 2,300 patients, that probiotics are safe and can have a beneficial effect in the short and long term for the treatment of BV. As BV can lead to UTI, our formulation also contains 36 milligrams of cranberry pro-anthocyanidins, which have a recognized role in bacterial anti-adhesion by preventing the recognition of bacterial adhesins by the glycoprotein receptors of urothelial cells. The bacteria are then eliminated by the urinary flow. In conclusion, BellaVie Synbioceutical WOMAN in just 7 days restores a vaginal flora rich in lactobacilli and reduces the risk of developing candidiasis associated with antibiotic therapy. It is recommended in combination with antibiotics. BellaVie WOMAN is a complementary option in the therapeutic arsenal of doctors. Now we are going to present you the marketing support. Here is a quick overview of all the support we have. BellaVie. BellaVie is committed to developing high-quality media to communicate its products. Thank you for your attention.